Hello, my name is Shiata Ernest, and I'm going to give a teaching project on fall precautions for the geriatric age group, and that's 65 or older. I don't have any geriatrics in my audience today, but I have children of geriatrics, which will help their parents to avoid falls. I'm going to give a pre and post test as my visual aids for my speech. There's my audience.
Get the test.
You can pick up your test. I'm gonna read it. Okay, we'll start with number 1. And number 1 says, which of the following are risk factors for falls in the elderly? A, visual impairment. B, decreased bone mineral density. C, poor dental care. Or D, both A and C. Just pick an answer. It's the post test. I should give you all the answers to these questions during the course of my teaching. Number 2 says, what is the estimated direct cost of falls in the elderly? A, $10 million. B, $1 billion. C, $50 million. D, $20 billion.
Mama, what's A?
You can't share answers, Javian.
I'm talking about right there.
I'll read it to you.
Which of the following is a risk factor for falls?
3. Which of the following is true regarding falls in the elderly? A, a patient should not use a walker to ambulate if their motor strength is intact. B, hip fractures are not the most frequent type of related fractures. C, motorized scooters is a better option to prevent falls in the elderly. D, medication use may contribute to increased fall risks. 4. True or false? Patients who fall, even if they are uninjured, are at risk of another fall. True or false? Here you go. I'm going to start with a few facts about fall precautions. Research shows that 1/3 of adults age 65 and older experience a fall. And 2 million older adults seek emergency care for injuries related to falls. Although all falls are not experienced by older adults, the majority of falls are. The precautions that I will teach you today can be used for yourselves as well as your older family members. Today, I will provide you with a post-test and a pre-test to test your knowledge of what you know about fall precautions. I will give you the answers to the test afterwards. One way to prevent falls is to make sure that you wear the proper footwear. By proper footwear, I mean socks with the skid-proof bottoms, and those are usually ridges or they have some type of words on the bottom to help you from slipping and falling. You can also wear shoes if you don't have those types of socks. You can use non-slip rugs on your floors and your bathroom especially, and even in your tubs. You can install hand railings beside the toilets and the walls, or even use an in-tub shower chair. During daily activities like putting up groceries or clothes, try to use your lower shelves first. By doing this, you can ensure that you don't have to reach or climb to reach the top shelves, and this prevents falls. If you have any loose handrails or benches around the house, make sure that you have them repaired as soon as possible. If you have any vision problems, you should get this checked with your doctor. If you're prescribed to wear glasses, make sure that you wear glasses around the home, because your vision is one of the main reasons that you fall. Make sure to put most of your weight on your strongest knee if you have any kind of walking problems. Make sure to use a walker or cane when ambulating to prevent falls. If you don't have a walker or cane, you can contact your healthcare provider to see if they can provide you one, or you can go to a healthcare supply store to purchase one. You can also purchase handrails and shower chairs there. Make sure that you have the lights on whenever you're entering and exiting a room so that you can see what's around you. When going to bed, make sure that you have a flashlight nearby so that if the lights go out, you're still able to move around. Talk to your physician or pharmacist about different medications that you take. A lot of medications, including your hypertension medications, can cause you dizziness when standing. If you have this problem, when you get up, dangle your feet or sit up for a few minutes before you choose to start walking. If you start to feel dizzy, don't continue to walk. Have a seat. When sitting down, make sure you feel the chair behind you before you sit. If you're walking backwards before being seated, make sure you feel the chair behind your knees. Make sure to prevent clutter in the home to prevent falls as well. Don't have your books or mail or anything piling up. These things could fall, you could slip, and it will cause more injuries than it's worth. Also, make sure that your throw rugs or blankets, pillows, things around the house are picked up. Clearing clutter prevents falls. Don't be afraid to ask for help from family members or loved ones when it comes to doing things around the house. Make sure that you limit your alcohol use, which could cause impairments and put you at a risk for falling. Also, have your hearing checked regularly, because not being able to hear can cause you to fall. If at any time you're walking and you feel unbalanced, you should find a seat. If you have fallen and you need help, 911 is always the best number to call. And even if you fall and you don't feel as if you need emergency help, you should still see your healthcare provider. Try not to carry more things than you can hold, because carrying the extra weight could cause you to fall. Make sure that your shoelaces are tied and your shoes are properly fitted in order to prevent falls. Just because you fall and you're not injured does not mean that you won't have another fall. Take these precautions to ensure that you're safe. In the United States, over $20 billion has been spent on injuries related to falls.